Hello guys, good morning. So I'm Ma'am Angeli and welcome to lesson 2. So ang subject natin isn't it that it's community and public health. So we will learn today about community health, public health, and all the relevant topics surrounding public health. So samahan niyo ako. So today guys, simulan natin. So what is public health and ano mga ba yung contributions ng public health? So we have been all throughout the years, we have been enjoying the benefits of public health, right? So just having clean water, hindi tayo nagkaka-gastrointestinal infection, bacterial infection, amoebiasis sa tubig, guys. Contribution yan ng public health. We also have the values of immunization, cleaning up the environment through environmental sanitation, health education, guys, 'di ba? Every time that when we watch our commercials in our social media, there are a lot of mass education, syempre sa mental health and so on, about COVID-19, organization of health services for early diagnosis and treatment of disease. So, yung mga health center natin, 'di ba, the health services are closest where we go to work, where we go to school, where we live. They are a lot more accessible because of public health yan. And development, meron ba dito, of social machinery which will ensure everyone has a standard of living adequate for maintenance of life. So, giving affordable housing, guys, provision of affordable and healthy meals, affordable fruits and vegetables, yan, contribution lahat yan ng public health, okay? And that's what we want to appreciate in this lesson 2, ha, ang kahalagahan ng public health. And sana mahalin nyo rin yung public health. Sabi, public health is both an art and a science of 3 P's. Yan, tatlong P. Preventing disease, prolonging life, yan, pinapahaba. We are decreasing the mortality and increasing the years that you could live. Promoting physical, mental health, sanitation, personal hygiene, control of infectious diseases, and organization of health services. Yan. So, our public health would keep our kids healthy, community strong, save lives, and save money. Ang raming benefit ng public health. So, imbis na yung mga bata natin, nagkakasakit sila ng measles, we give them childhood vaccines, di ba? Instead na magka-polio sila, kompleto ang mga bakuna nila because it is more cost-effective for the Philippines to do that, okay? Mas cost-effective, it give people better and happier lives kung hindi sila nagkakasakit at masasaya ang mga barangay, mga community. So, ang raming value, guys, ng public health. And today, di ba, sa subject na to is, we want you to appreciate what the value of public health is. So, meron tayong community health and public health. Actually, guys, dito nga muna tayo. Community health is under public health and even primary healthcare. So, ito yung malaking sphere natin. Yung umbrella natin is public health. And under it is community health and primary healthcare. So, i-compare and contrast natin. So, when we say public health, guys, it's the art and science of promoting, preventing, and prolonging life. So sabi nito, ang public health daw, it has a technocratic characteristics. So when we say technocratic, guys, kailangan ng technical working group, technical experts who will decide what to implement in public health. So actually, the highest experts that we have are WHO, CDC, itong mga Opta researches. And example ng technical working group natin, guys, sa Pilipinas, if you remember, during the pandemic, lagi natin sila narinig is the IATF. Sila yung nagsiset ng standards on the precautions or the protocols that were implemented during the pandemic. Yan. So, public health, so you need a technical working group or technical experts, group of yan, sila yung nagde-decide. Pag community health, guys, ang mga nagde-decide, yung mga tao, because they decide on what are the needs in the community. Okay? So when we say public health, there is a group of people who decides for the health of the people. However, for community health, the community is the one deciding for their health. Okay? So it's public health is more on a governmental solution. It could be sometimes imposing, sinasabi nila, o dapat implement nyo to. Yan, implement nyo tong social distancing because the WHO said it, kailangan mag-face shield, kailangan walang face shield, kailangan mag-mask, kailangan walang mask, and so on. And it's a top-down strategy. So meaning, the higher authorities will impose laws for the local government units to follow, okay? However, for community health, it's a bottom-up strategy. So the community is the one who decides what they want to implement based on the need, on the community. Tapos it's a bottom up, and they will say to the barangay official, to the city mayor, that these are the things that we implement. Yan. So sabi kunyari ng isang barangay, mag-urban planting kami. Yan. So, since nagustuhan rin ng mayor, yan, in-implement niya na, lahat na ng mga barangay is mag-urban planting. Yan. So, it's a bottom-up strategy. It is more on motivating, empowering people to do what they want to do, and social capabilities yan. So, they activate the different sectors in the society to implement their activity. So ito, mga deworming, kasi guys, ang advantage naman ng community health, the community knows what the diseases that are common in the area. And sometimes these diseases are unique. Example, sa mga Northern Luzon area, sa mga Cagayan, guys, uso ang sakit na schistosomiasis. Yan. So, ayan, nagpapa-deworming sila ng mass deworming sa mga children because this disease is common in their area. Yan. So, yan. So, sa public health, more on yung DOH, yung mga technical working team, ang nag-a-assign kung anong mga goals for the year and so on. Pag community health, more on democratic. Yung community ang nagsasabi kung anong i-implement na health program. Okay? So, community health is the collective well-being of the community members. Hindi ba pag sinabi natin community, it's a group of people who has a common identity. They live in a defined area. They interact with one another and so on. So the community health addresses the disparities in the community. So if there are inequalities, yung mga people who needs more help than others, yan ang focus ng community health. They take care of the most vulnerable in the community. And while primary healthcare, yan. So may pagka-overlapping tong mga to kasi nga tingnan nyo nga yung circle, no? Yan. Hindi siya magkakahiwalay-hiwalay. May mga overlapping silang ginagawa. And the three of them, they want to promote health silang tatlo, okay? It addresses the majority of the person's health needs throughout the lifetime. Pag sinabi natin primary healthcare, more on individual, more on personal. Pero pag sinabi natin community health, more on the collective health of the barangay or the group of people. So, pag primary healthcare, sabi niya, yung needs ng isang tao all throughout their lifetime. So, from their childhood to their teenage years, to their adulthood, to their geriatric stages, there are available health services for them. Okay, so define naman natin, guys, ang primary healthcare. Yan. Diniscuss ko na to sa health information system eh. So, primary healthcare are essential healthcare. Walang labis, walang sobra. So, essential yung mga talagang kailangan na health services based on the things which are practical. Yan. So, it's practical, I mean, simple, sabihin natin affordable, scientifically sound, yan, it's recommended by international standards, it's socially acceptable methods, yan. So it's culturally acceptable, technologically made and universally accessible. So itong mga primary healthcare, these um are your basic healthcare services for individuals and families in the community by means acceptable to them through their full participation. So we're just not merely ito yung health services sa inyo na no, we need their participation. It's a give and take, okay? They are not passive. Yung mga tao hindi lang sila passive receivers of healthcare, but they are they are also part of deciding health for themselves. Ayan. At a cost that community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. So guys, back then yan, before the Alma Ata Declaration, so yung Alma Ata Declaration, it is the very significant event that coined the term primary healthcare. Yan. So ito yung talagang mga essential na health care services natin. Example is providing your essential medicines. Yan. So example, mga gamit sa hypertension kasi madalas na ginagamit, mga vitamin C and so on. So these are very practical, scientifically sound, and acceptable methods. Yan. Sanitation, proper nutrition is also part of primary healthcare yan. Kasi na-appreciate nung Alma Ata Declaration that health is a human right. Yan. So everyone should have access of the essential healthcare services. Yan. So that's primary healthcare. So, ito, nung 1978, there is the Declaration of Alma Ata, wherein they established the value of primary health care. So, yung mga primary example ng mga primary health care facilities natin ay yung mga clinic natin, guys. Health services where the people work and live. Yan. So, sa mga barangay natin, may mga health centers. Those were possible. That happened because of the declaration of Alma Ata. Okay? At talagang nagpro-progress naman itong Alma Ata. Okay? And now, ang dami na nating goals when it comes to health because they appreciate that health is truly part of the development of people. Para maging successful, para maging masaya, productive ang mga tao, talagang na-appreciate na nila ang value of health. That's why we also have Millennium Development Goals. So from 2000 to 2015, the whole world, guys, is trying to achieve these goals. We have 8 goals. In MDG. I'll show you later. Tapos, after ng 2015, we had SDGs, Sustainable Development Goals. We're trying to achieve 17 goals right here. And because of that sustainable development goals, ang Pilipinas, we have crafted in 2019 Universal Healthcare, RA 11223. Huwag niyong kakalimutan yan, okay? Universal Healthcare. So, itong mga apat na to, guys, these are all milestones. It's very monumental, guys, on what is health now. Talagang, how we value health at the moment and how health really contributed to the development of people. So, ito yung Millennium Development Goals, guys. So, noong 2000 to 2015, they set 8 goals to achieve. So, sa Pilipinas, may mga na-achieve tayo, meron tayong mga hindi na-achieve. Yan. So, I think, dito sa number 6 is we eradicated polio. I think that's one of the accomplishment ng Pilipinas when it comes to the Millennium Development Goals. At ayan, so we have 8 goals. So now we have 17 goals for our sustainable development goals. So when we say sustainable, something is sustainable, it meets the needs of the present without compromising the ability of future generation to meet their needs. Okay, so binavalue natin yung kalikasan pa rin natin, guys, kasi nga we value the next generation. So we want to get their needs. However, we look forward and value our environment, ganun, kasi yan, for the future generations. Yan. So, yung 17 goals natin, no poverty, zero hunger, good health, quality education, gender equality, and so on. Yan. Basahin nyo na lang. Okay. So, pag-usapan natin ano bang roles ng healthcare, where do we come in? So, we have 3 contributions. We are part of the promoting health and primary prevention. So, habang hindi pa nakakapasok ang sakit sa katawan ng tao, is we need to promote health already, and yan, we promote exercise as well, part rin yan, our vaccinations, our promotion of good nutrition, and once the disease would come to its preclinical phase or incubation period. Pag sinabi nating incubation period, the time wherein the infectious agent will enter the body and up to the time the symptoms will appear. So, during the incubation period, example guys, COVID-19, dengue, 14 days ang incubation period. So, sana during those times is meron na tayong screening and early detection. Okay? Example, yung mga cancers like breast cancer, before it would go to its final stages, di ba? Sana during the preventive stage, meron ng mga libreng pamammogram. Diba? Ganun. So, ayan, may secondary prevention. So, screening and early detection. Just like HIV, guys. So, we screen those who have high-risk activities. Yan, para simula pa lang ma-counsel na natin, ma-screen na natin, at pabigyan na natin ng antiretroviral therapy, which is libre. Diba? And we also have tertiary prevention and rehab. Actually, ito na yung pinakamahal. Pag kunyari rehab na, so ibig sabihin, example is na-stroke na yung tao, kailangan na i-rehab. Yan. So that's tertiary prevention. Example, palliative care. Those who are in chronic pain, chronic disease, yung may mga cancer, we take care of them. So mahal na yung mga yon actually, di ba? Kasi nga prevention is better than cure. Ayan, mas mura ang mga preventive activities kaysa sa mga talagang therapeutic activities. Ayan. So, ayan. So, we are really part of the prevention of diseases. And actually, that's part of public health. We want these preventive services to be more accessible for the people. Okay? So, guys, ito naman yung healthcare access pyramid natin. So, yung primary healthcare natin, andito sa baba. Yan. So, later I'll show you a photo wherein there is the proper referral system. So, meron tayong mga health and care centers, local hospitals, acute hospitals, and regional centers. Example nitong mga regional centers is yung mga Baguio General Hospital, mga regional hospital natin. And so, sila na yung nagbibigay ng mga tertiary services, guys, yung mga specialized services. Yan. So, kunyari, nagsisimula pa lang magkasakit, so we first go to primary care services instead of going directly to regional centers. Yan. So, there is a pyramid that we try to follow. Okay. So, what could be, guys, your future roles naman? Pag kunyari, nasa community na kayo, nakagraduate na kayo. So, what do? Yan. So, we try to meet the health needs of the community. So we don't expose, ito yung gawin nyo. We don't impose, ito yung gawin nyo. So sometimes, they would say what are their needs. Yan. Especially if may mga community health workers sila, barangay health workers. They will tell us what are their health needs. And we try to fill the gap. We try to fill the gap kung ano yung mga kailangan nila. Okay? So, mas alam ng barangay kung ano ang kailangan nila. We adopt public health approaches. We public health approaches to protecting the public. And we use yung mga mass deworming, ganyan. We do outreaches, medical outreach. We support self-care. So if they're doing personal hygiene already, we support, we improve their technique, ganyan. We work with other teams, with other agencies. We support anticipatory care. When we see anticipatory care, they plan. So people will plan on what healthcare they want in the future. Yan. So we support them to that. So, yeah. Nice. So, paradigm shift for service delivery. So, ito lang guys, I just want you to let you know na meron tayong old paradigm and we're trying to move on to a new way of thinking. So, gone are the days that we just react on disease. Yan. So, kung ano yung mga disease, yun yung i-cure natin. But, what are the needs? Because sometimes, example, they need clean water. Yan. So, if we provide them with clean water, it will prevent waterborne diseases. Sometimes we focus on the needs instead of just the disease. We focus now on the population as a whole instead of individuals. So we're trying to help not only one person but more than a family, ganyan, a community. So ang ganda ng public health, guys, kasi ang laki ng impact ng magagawa ng intervention nyo. It will just not improve the health of one person but the health of the whole population, di ba? We have continuum of care. So the care lasts for a lifetime. Not only pag may sakit yung pasyente in a small period of time, but from being a baby hanggang maging mommy siya, hanggang maging lola siya, is we take care of them. Ganun. And it's not fragmented, but we coordinate. We work with other delivery services, with other agencies, para mas mapaganda yung health services natin. Because let's be honest, the government cannot do it all. So we tap faith communities, we tap grassroots. We empower grassroots para instead na dentista lang nagbubunot, guys, pwede mga grassroots, they are trained na magbunot, magtahi. Yan. May mga NGO na nagte-train ng grassroots so that they would be the health workers in that community. And we provide the appropriate care at an appropriate level. Hindi tayo nagbibigay ng bultuhan na health services, but we give what is appropriate because we don't want to waste any resources. Yan. So that's a new paradigm. So the doctors, the nurses, the PTs, the medics are a team. Okay? Hindi tayo nag-work ng kanya-kanya. Yan. So there are already networks. Yan. We work together para ma-achieve natin yung better health for the people. Diba? Guys, ang ganda. Ganda ng layunin ng public health. And because we need to, and there are a lot of determinants that affect the quality of health in a community. Diba? So gone is the time na nag-focus lang tayo sa sakit, 'di ba? Because health is not only the absence of disease or infirmity, 'di ba? So we try to take into consideration kung saan sila nagtatrabaho, saan sila nag-aaral, their physical environment, where they live. Because the area where people live sometimes will increase the chances of diseases. Example, kunyari sa mga magkakadikit na bahay-bahay, ayan. So, pwedeng maraming nagkakahawaan ng mga sakit kasi their living conditions is poor, their working condition is poor, 'di ba? Social environment. So, are there, yung mga community will natin, are there social services available for the people? Example, yung mga tupad, for peace. Because some people are, talagang they need a little help. They need a little boost. Mga nagbibigay ng scholarship program, guys. That's part, that will affect health as well. Example, families who are experiencing domestic violences, kanyan. So, kakaroon sila magsusumbong. So a healthy social environment is part of um is a part of uh, determining the quality of your health, your genes, guys, behavior, lifestyle. So example, mga high-risk behavior, yan makes you more prone to HIV, to STDs. So high-risk behavior, or kunyari sedentary lifestyle, not exercising, not eating well, yan. So it will affect your health, yan. So ito yung mga health problems, health needs na ina-address ng mga community health workers. Are the healthcare services accessible? Available ba? Yan, baka si doktor naman sa healthcare center, laging naka-seminar, diba? So, is it socially sound, diba? Yung mga, yung natin ng primary healthcare, is it practical? Diba? Is it quality? Mura nga, no quality. No quality ang effect, diba? Ang end product. So, it affects our health. So, in our public health, guys, we want there is community action and innovation. We want our community to be mobilized, guys. Gumagalaw. Everyone is working towards better health, yeah. Para malakas, masigla ang isang community. Okay? So, we will discuss in this part, yan, the planning and implementing of community programs and centralization versus decentralization. Okay. So, define lang natin muna yung planning. Yan. So, planning is the process of defining community health problems. Yan. So, identifying the needs and resources, establishing priority goals, and setting out the administrative action needed to reach those goals. Yan. So, yan, when we plan, we collaborate with our barangay officials because they know what are the needs of the community, or sometimes they don't know. So, we could be mobilized tayo, mga University of Baguio, to make health needs research, di ba? Para malaman kung anong needs ba ng isang community, what ails them, ganyan. Baka marami na palang waterborne diseases sa barangay, o kaya ang marami palang nagkaka-mumps, di ba? So, yan, we plan. So, we set goals, we set priorities, okay? Kasi, ang dami nating goals, pero the resources are limited. So, sometimes we need to prioritize. Sabihin natin, top 3 lang muna for the year 2023. And so, if we have crafted a health program, example, marami na palang mga bata na, malnourished, diba? So, we plan for that. And we implement the health program. Yan. Pwede sa individual, pwede sa community. Yan. Put the plan of care into action. Okay? Then, we monitor and evaluate the health program that we will perform. So, when we say monitoring and evaluation, we oversee, guys, the health programs. So, monitoring is the systematic and routine collection of information from the program. So, systematic and routine. Sabihin natin, i-monitor yung program every quarter or annually. Yan. So, to assess if we are achieving our goals, okay? And evaluation means we assess the completed health program. So example, natapos na yung program natin ng 2023, we assess if was the program, itutuloy pa ba natin ng 2024? Yan, we ask those questions. Was our health program relevant? Efficient ba siya? Effective ba siya? Yan. Were there people who became less depressed, kunyari mental health program, di ba? And more people who are becoming more productive because of our health program. Yan. So this is actually cyclical, okay? So ulit-ulit to mga health program natin. So example, di ba, tinanggal na nila yung implementation ng mask in open areas, ganyan. So we still monitor if that um, health program is effective, 'di ba? Or kailangan ipasuot ulit natin yung mask and so on, 'di ba? It's continuous planning, implementation, monitoring, and evaluation. Yan. So, nakakapagod magtrabaho sa DOH, guys. Because you want to see, after you implemented the health program, you have to check if the program is effective, okay? Or else you're just wasting time and resources. Okay, so in our planning, we take note the culture, the political and policy system. So hindi tayo basta-basta gustong mag-implement ng program, okay? So we collaborate with the barangay officials, with the officers in charge, the economic systems, kung may budget ba, di ba? And yun, you want to address this pollution, climate, and so on. So when we implement yan, so we activate the community. So hindi lang sila passive, okay? They are active participants. Every time that we want to implement a health program, community social support, and we measure outcomes. Yan. So kanyari, example, we promoted hand washing. Yan. So, nung i-monitor na natin, were there change in behavior, di ba? Na ang rami nang naghugas ng kamay, nabawasan na ba ang mga nagkakasakit? Yan. So, yan. And so on. So, guys, meron tayong mga terms dito na centralization and decentralization. Example of centralization, what happens when the health when health in the Philippines is centralized. Ibig sabihin, funds for healthcare services come from the national government. Decentralized funds for healthcare services come from the local government. So ano kaya? Ano na ba ang health natin sa Pilipinas? Centralized na ba or decentralized? Are our funds, tama ba, sa Baguio City nanggagaling ba sa national government or galing sa local government? 5, 4, 3, 2, 1. Ayan. So, galing sa local government. So, actually, ang healthcare natin is already decentralized here in the Philippines. So, what does that mean if it's decentralized? There are lesser hierarchical levels. So, kung may gawin sila sa healthcare dito sa Baguio City, hindi na kailangan ng approval ng DOH. Okay? Those at the bottom are empowered to make decisions. Those at the bottom have more accountabilities. So, sa City of Baguio, ang nagbo-monitor ng health natin is the government of City of Baguio. Okay? So, pag centralized ang isang healthcare, there are more hierarchical levels. Those at the bottom have no or little power of decision making and little accountability. So actually guys, example, taga Pangasinan kayo. So ang healthcare sa Pangasinan is decided by the local government unit. Yan. So nangyari ito dahil sa Local Government Code of the Philippines. Yan. So after 1992, decentralized na. So, example, yung mga province sa Benguet, yan, sa Isabela, sa Aurora, sa La Union, guys, Ang in charge ng mga district hospitals ay mga provincial government. Ang in charge ng mga rural health units ay ang municipal government. Ang in charge ng mga city hospitals and rural health units ay mga city government. Okay? So, it is already decentralized, meaning the authority is already distributed. So, hindi na ang DOH ang nagde-decide lahat. So, DOH has technical working teams who will recommend ganito ang standard ng isang laboratory, ganyan, and we will follow all the standards. However, some health needs which are really um, only unique to that city government or municipality, sila na ang nagde-decide. And anong masasabi niyo dito na decentralized na yung government? Maraming good, maraming bad. Yan. So, yung good is maraming accountability sa baba. So, at least those who are in the municipalities, they know what's happening and they act on the health needs, okay? Ang bad doon, if they know the health needs, diba? So, if the city mayor does not care about health, then the city will have poor health. Yan. So, yun yung bad doon. Okay? So, there are good and bad of having centralized and decentralized healthcare system. Yan. So, but we could, maraming good sa decentralized, but, marami pang kailangang ayusin. Yan. Kasi nga, the decision making is coming from the the governor, is coming from the mayor. Yan. So, dapat maglukluk tayo ng mga tamang leaders that would care about health. So, what are a few here? Malapit na tayo. Strategies for community action. Yan. So, number 1, accessible, acceptable, available, and affordable health services. Yan. So, there should be health services where they live and where they work and where they play, guys, na talagang accessible, malapit talaga sa mga tao. Yan. So, there should be community health workers. Sabi dapat the ideal ratio should be 1 community health worker is to 20 households. Actually, parang ang konti. Pero, there must be community health workers. Yan. We need to empower the community member na sila rin mag-aalaga ng isa't isa. Okay? The technologies used should be low cost, affordable. Yan. So, dapat may stethoscope, thermometer, weighing scale, all the basic medical supply should be present in the community. And thank God, they are already affordable, hindi sobrang mahal. Yan. So, the utilization of herbs, yan, walang problema dyan. Yan. So, example yan, mas mura ng mga ultrasound, hindi na milyones. Yan. Meron na tayong mga point of care testing. For glucose testing, you don't have to buy a big machine. Ayan, 500,000 machine to check for glucose. May mga affordable point of care testing na tayo. Meron na tayong acupuncture, guys. Yan. I found out that it is good for managing chronic pain in low-income communities. Yan. So, may mga pain, mag-acupuncture. Partnership between the community and health agency. So, hindi magagawa ng gobyerno mag-isa, okay? It needs the participation of other agency, private, government, faith, non-government, organization, universities, guys, mga outreach, para ma-improve ang health ng mamamayan. We need I want to emphasize this, community participation, okay? Dapat parte ang community. Yan, they are conscious. They are aware on what's happening in the community and how together as one they could improve the health of the community. Yan. So, community discussion done through small group discussion. Yan. Kasi nga, mas maganda sila nag-iisip ng solusyon sa health problem nila. Yan. Kasi para sila rin ang gagawa. Yan. So, community nila. So, we want to engage them. Yan. Hindi sila passive receivers, but they are active participants of their health. Yan. So, yun, dapat nagpa-participate sila. Alam niyo naman guys, ang isang classroom na hindi nagpa-participate, di ba? So, kung ang community nagpa-participate, yan, mas madali nilang ma-achieve yung mga health goals nila. What else? If there is community participation, yan, we train more community health workers. There are health committees, meron sa health. Sa barangay namin, may kagawad in charge of health, in charge of nutrition, in charge of peace and order, hindi ba? Sa sports. So, yan, maganda pag lahat ng sector ng community is activated. Yan. So, each one is part of the mass health campaigns, kunyari deworming, yan, or paglilinis ng mga yung pang dengue guys, kung saan nakokolekta yung mga tubig, yan, i-drain ng mga tao. So, we train more community health workers. What else? We develop the attitudes, knowledge, and skills of community health workers. Diba? So, yan, everyone is mobilized. Yan, tapos dinadala sila sa seminar, ganyan, pinaparami pa sila. Itong mga community health workers, ititrain mo, and eventually, magtitrain rin sila ng ibang community health workers. Hindi pa ganoon, diba? Ang saya ng community pag lahat nagpa-participate. Yan. Kunyari, sinabi ng barangay captain, okay, lahat ng aso natin itatali natin. Okay? Tapos tapat mo, linis mo. Kung lahat ng household ginawa yun, ang linis-linis na siguro ng city of Baguio. So we want to mobilize our community that they would also be self-reliant, okay? That they will not just depend on donations of health agencies, other agencies, but they would generate livelihood that will support the healthcare system. So, kunyari, meron nga silang healthcare sa barangay nila, yan, to make it sustainable, kailangan, di ba, merong mga pangkabuhayan sa community. There should be income-generating projects and cooperatives. Yan, diba? Saya nila, What else? To recognize the relationship of health and development. So, kung ang tao, guys, sa isang barangay, sa isang bansa, lahat sila nagkakasakit. They're always getting sick. Of course, there would be no development. And that's what we're trying to do here in public health. We want to let you know that health should be present in all policies. In policy making for water, in policy making for nutrition, in policy making for work conditions, housing, actually, health should always be integrated to them. Kasi nga, kunyari, for transportation, yan, lots of people are dying because of car accidents. Yan. Of course, there will be our development will be hindered because people are bad drivers, not following the traffic rules and regulations. And it could affect our development in health, of course, diba? Naapektuhan dyan. Nutrition, water, yan. So that people will have equal opportunities to achieve the highest level of health. Yan. So kasama, health should be integrated in all sectors of society. Okay, sa agriculture, 'di ba? Kung nagmamahal ang mga healthy foods, 'di ba? Paano na makakabili ang mga tao? Wala na silang magiging healthy. Yan. So, kailangan yun, binabantayan itong mga to. Yan. Yung natin, public works, communication, yan. It should be smooth. So that information, good, reliable information on health will be disseminated. Okay. Social mobilization. The process of engaging people in action for a common goal. Yan. So, we will establish effective health referral system. So, may referral from primary health services sa mga barangay health station, rural health units. Kunyari ire-refer sa mga district hospitals, tapos mapupunta na sa BGH, yan, mga regional hospitals, yan. So, everyone is mobilized. Everyone could be tapped. Yan. Kasi hindi kaya nga ng isang organization. Dapat tulong-tulong. It is multi-sectoral and interdisciplinary. So, gone are the days na talagang independent ang isang agency. Okay, uso na ngayon ang linkages. Ayan, may mga stakeholders yan na nagko-collaborate, nagpa-partner, yan, so that they could achieve greater goals. And finally, guys, decentralization. Yan. So when there is decentralization, our barangay officials become more accountable. The people in the barangay are more accountable. They are the ones who decides on their health. Yan. So, tayo, advocacy for political will and support from national to barangay level. Yan. So guys, let's choose our barangay officials will. Yan. So that, mas healthy ang mga barangay, with orientation of health professionals and other sectors regarding primary health care. Yan. So they should be trained on the value of strengthening the primary health care centers in the community. Yan, palakasin pa para mas maging healthy ang mga tao. Para as to prevent diseases, hindi yung mga sakit, magpapa-check up lang yung pasyente kung malala na, 'di ba? Dapat gone are those days that stops people from getting a check-up, okay? Kasi ang marami ng available means for them to be taken care of. So guys, that's it. So do you have any questions? And our discussion ends here. So I'll see you again. Bye guys.